Hi folks, Dr. Burke with Pathways Integrative Health Center. Today I want to answer one of the common questions I get from my patients. Doc, why do I have neuropathy, or why do I have peripheral neuropathy? So what that is neuropathy means nerve pain. It's usually numbness, tingling, burning, or just pain. And when we say peripheral, it means that it's in the extremities, usually the feet, sometimes the hands. And there's a lot of different causes for it. One of the common ones I want to talk about today is one I see so much in people, and that is cholesterol-lowering drugs and medications, also known as statin drugs. And to there's been a paradigm for a long time that high cholesterol is the cause of heart disease. And what we're seeing now, borne out in research and results, is that that's not necessarily the truth. Statin drugs are the #1 prescribed medication in this country, and if we would expect, with the high amounts of statins being taken, that heart disease would be declining, and it's not. It's actually staying the same, or it's actually increasing compared to the past. What we're learning now is the main primary mechanism of heart disease is inflammation. Chronic inflammation we call meta-inflammation, where the whole body is inflamed. And that will cause cholesterol and other things to stick to the walls of the artery, creating the hardening the arteries that we call heart disease. So what we're seeing now, though, is that the cholesterol is not the big part. In fact, cholesterol is really, really important. Cholesterol is a very potent antioxidant. It's an anti-inflammatory. It makes up the building blocks for all of our hormones. It makes the building blocks for our cell walls. And in particular, in our conversation today, it makes up what we call the myelin sheath of our nerves. So imagine a nerve as a wire, and wires need insulation, and they need insulation so things don't short circuit. So you have nerves all running next to each other, and if that myelin sheath breaks down, because what's happened is, if cholesterol is being artificially lowered, your body will start to look for cholesterol-rich sources to cannibalize it, to try and save something else of higher priority. Apparently, in your body's search for survival, it considers feeling pain, numbness, and burning in your extremities is less important than something else, probably making hormones and cells. So when that myelin sheath breaks down, those nerves start to short circuit. That can happen in the nerves in your extremity, we call it peripheral nerves. It can also happen in the nerves in our brain. That's why we're actually seeing with statin drugs, one of the common things we're seeing is increased rates of cognitive decline and dementia and things like that, because our brain needs 3 things to work. It needs good oxygen, it needs good blood glucose, and it needs good nutrients. And good fats and cholesterol are really critical for brain function. The other part is, and this I think is the really big part, is statin drugs destroy the production of something called coenzyme CoQ10. In all your cells in your body, you have little organelles called mitochondria. And mitochondria take 1 molecule of glucose. Everything you eat, at the end of the day, gets turned down to a molecule of glucose. It goes through a thing called your Krebs cycle to make 38 units of energy. And that whole process is very dependent on coenzyme CoQ10. So when that production gets affected by a statin drug, you lose your ability to make energy. And if you think about that, it makes a big difference, because your brain is about 8% of your body weight, and it consumes over 30% of your energy. The other high area of energy consumption is your skeletal muscle and your heart muscle. So if those organs cannot make energy efficiently, bad things start to happen. That's a cognitive decline. That can be other cardiovascular issues. So if you've seen a doctor and they've not told you about this and not recommended that you add in coenzyme CoQ10 into your supplement regimen, they've really done you a disservice. Now, I want to say something really important. From what I share here, if you decide the statins are a bad idea, you're going to stop taking them, don't do that. Go talk to your doctor, whoever prescribed them, and have a conversation with them that you're worried about these issues. And other than that, when it comes down to it, we're always looking for creating the environment for having a healthy nerve. If you see on one of my other slides, we have a very other videos on the web of physiological dysfunction. We see how everything is intertwined. Blood sugar affects nerve function, fat metabolism, liver function, digestive issues all affect nervous systems. Looking at a very big picture, this is just one small part of it. So I hope this was of help to you. Hope you got something out of it. If you have any further questions, you can reach out to me via email or at our website that's attached to this post. Otherwise, thanks for watching and have a great day.